Hello, welcome to the Community Health webinar series. This month's topic, we'll be discussing health literacy with our presenter, Eugene Gallego from the Great Plains Good Health and Wellness Program. Health literacy is important for public health professions in understanding the communities we serve. In order to ensure that our health messaging is adequately reaching our target populations, we intend for the messages to convey, it is imperative the level of understanding that constituents who receive health messages have. When the level of their understanding is defined, it better equips professionals in relaying messages in a proper and efficient manner. Understanding how to properly communicate those messages is possible through health literacy assessments, which will help practitioners understand the level of comprehension that is received in the community regarding health information, health messaging, and other health communications. Health literacy is an effective tool for creating potential barriers that may be preventing people from understanding the messages that they are attempting to convey. It is speaking health in a language that populations we serve can understand. So at this time, I'd like to present Eugene Gallego. Eugene, you can go ahead and share your screen.
Can you see my screen with the health literacy clear health communications?
Yes, we can see your screen.
Okay. So thank you for joining me in today's community health webinar. Health literacy, as mentioned before, my name is Eugene Gallego and I'm the program coordinator for the Good Health and Wellness Program. For those who don't know me, I assist all 18 tribal communities and 10 subawardees in the Great Plains region, which is North Dakota, South Dakota, Nebraska, and Iowa. I provide training and technical assistance to help tribal communities reduce the burden of type 2 diabetes, heart disease, and stroke by focusing on physical activity, nutrition, community clinical linkages, team-based care, breastfeeding, and health literacy. So today I'll be covering health literacy, and I'll be covering the basics of understanding health literacy concepts, the importance of health literacy in Indian country, and how to integrate health literacy in your project or program. Health literacy. What is health literacy? Health literacy is a patient's ability to obtain, understand, and act on health information and the capacity. Sorry, I'm having technical difficulties with my slide. There we go. And the capacity of healthcare providers and healthcare systems to communicate clearly, educate about health, and empower patients. It is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. The problem with health literacy. So here's the problem with health literacy. People who are in the lower percentages of health literacy do not seek preventative care because there's a lack of obtaining and understanding prevention information or promotional signage. There will be a lack of seeking care. The reason for a patient's inability to follow and understand health instructions is because the patient's low literacy skills. A lot of patients who have low health literacy level have a low numeracy level, which results in the inability to read prescription labels and instructions. It is estimated that over 90 million adults who have low health literacy have levels have a more difficult time reading instruction labels on prescriptions, appointment slips, and health education materials. Many patients work hard to hide the fact that they have trouble understanding something they are told or given to read because they're all too often embarrassed or do not want to appear to challenge the healthcare provider in any way. Also, in a recent study, adults 16 years or older with low health literacy skills tend to stay 2 days longer than those with high literacy skills. Only 12% of adults have proficient health literacy, according to the National Assessment of Adult Literacy. In other words, nearly 9 out of 10 adults may lack the skills needed to manage their health and prevent disease. 14%, which is 30 million people of adults, have below the basic health literacy. These adults were more likely to report their health as poor, 42%, and are more likely to lack health insurance, which is 28% than adults with proficient health literacy. So like mentioned before, low percentage of proficient health literacy in adults, 14% of adults have below basic health literacy. Low literacy has been linked to poor health outcomes such as high rates of hospitalization and less frequent use of preventative services. So why does health literacy matter? According to a recent study by the Program of International Assessment of Adult competency, only 12% of the US adults scored in the highest proficiency levels and only 9% scored in the highest numeracy level. With the assessment, there were 3 domains that were assessed in adult proficiency. 1, which is literacy, 2, numeracy, 3, problem solving in technology-rich environments. So some people may be asking what numeracy is. Numeracy is the ability to access, use, interpret, and communicate mathematical information and ideas, to engage and manage mathematical demands of a range of situations in adult life. The adults were scored on the proficiency level from 1 being the lowest and 5 being the highest proficiency level. So why is this a concern? 85% of Americans who are literate do not understand the information that has been given to them from their healthcare provider. Not only is it your healthcare provider, but it's also healthy promotional signage and PSAs as well. And I like to put this picture up. What part of the mathematical equation don't you understand? And that's how it is with a lot of people who are health literate. Some of them don't understand what their healthcare provider is giving them. Health literacy can help you to navigate the healthcare system, including filling out complex forms and locating providers and services. Also share personal information such as health history with providers, and engage in self-care, chronic disease management, and understanding mathematical concepts such as probability and risk, which was the numeracy domain. So here are some of the factors impacting health literacy. Health literacy is dependent on individuals and systematic factors. Communication skills of layperson and professionals. It is important that communication is clear from professionals to individuals or patients. A lot of people with low literacy skills are masters at concealing their deficit. What also poses a challenge is that a lot of people with low literacy levels are very articulate in speaking, which makes it harder to detect that there is a problem. Lay and professional knowledge of health topics. Culture is a huge factor due to the fact that the majority of low health literacy is among racial and ethnic minorities, as well as individuals who are non-native speakers of English. Being able to communicate clearly to individuals with different cultural backgrounds is important. So for example, a patient's health literacy is impacted based on the practitioner's ability to spend time with him or her. A tribal health program may have limited availability to explain health information, whereas a nurse practitioner may have time allocated to discuss pertinent issues with the patients. And that was with the demand of situation and context. For creating issues impacting, for factors impacting health literacy, it also creates impact on outcomes, quality, safety, and access. Healthcare services and institutions are complex and confusing. You can call a nurse line, visit your doctor, make a trip to the ER. You can even email your doctor or clinic and schedule an e-visit or stop by your local pharmacy. Where do you go to find the care that you need, and how do you get there? And once you're there, whether online or in person, how do you find the information needed? For the quality, patients with low health literacy may not accurately report their conditions on their medication, which can be dangerous. Informed consent or often written less for the patients, and more legal protections are complex. Patient satisfaction is important. It is an important measure, and patients who have trouble understanding their doctor's instructions often report low satisfaction. Health professionals also need to pay attention to cultural and linguistic needs of patients in order to ensure they receive quality care. Low health literacy impacts understanding of medication labels and treatment regimens. Treatment adherency problems can arise when patients don't understand the importance of maintaining a treatment course or showing up for the following appointment. When it comes to age category in health literacy, older adults are at risk along with minorities. Adults with lower education level, primarily lower than a high school diploma or GED. People with compromised health statuses, people with English as the second language, and individuals who have lower income levels. Lower income levels may be related to a lower education level. Here are some factors about elderly. There are more than 36 million adults age 65 and older living in the US. Seniors struggle with understanding and acting on health information more than younger adults. Ways to assess. So here are some assessment tools: the Frye readability formula and graph. Health literacy is understanding how your population receives healthy health messaging. There are multiple options for readability and testability, including a short test that measures the number of words that were understood, dividing by 3 and count points accordingly. The Frye readability testing is a formula to gauge an individual's reading level. In the Frye, it has a guide for individual score and interpretation. So the readability score for the Frye, 4th through 6th grade, it's easy to read, more likely readable by most adults. And 7th through 8th grade, average, likely readable by half or more adults. And high school and above, the majority of readers reading this will miss the information that is being presented. So with the Frye readability formula, the top picture that you see is the graph, and that's how you would be able to use to gauge it. The formula has the formula has a formula to average an individual's level. It's formulated by calculating the number of sentences and the number of syllables. The average is then plotted in the Frey graph to find the grade level. You can also analyze a short passage or message to calculate the reader's interpretation. This is done by analyzing a passage fewer than 300 words. So with that, with the first one, you count the total words, total sentences, and the total syllables for the entire text. And in the second part, you do these calculations, multiply the number of sentences by 100 and divide by the total number of words. This will give you an average number of sentences per 100 word. And you multiply the number of syllables by 100 and divide by the number of total words. And third, you plot the average of the Frey graph to find the readability score. This is kind of it's kind of hard to understand at first, but if you need any of that information with the Frey graph, I'll be glad to send it out after this presentation. Another one is the REALM, Rapid Estimate of Adult Literacy. This would be a quick tool assessment to gauge an individual's literacy level. With REALM, you have 3 lists of words, and on the bottom right, that's the actual room. You'll have the patient read each list accordingly. When an individual comes to a word they cannot read, they are asked to do the best in reading or say blank and go to the next word. Once you're done scoring each 3 lists, you'll take the total and match it with the grade equivalent. And then the health literacy tool shed. This is another useful tool that you can use in assessing. It is a website, and you can also click on the link, which will pull up the page shown on the bottom left. There's multiple assessments that you can do, pretty much everything in public health that would be useful in assessing health literacy. So here are some ways to promote health literacy in your work environment. Health literacy policy. Sustainability in your work environment is key. Get your leaders on board and implement literacy considerations in your organization's policies and procedures. Keep in mind, even people with good literacy skills find that understanding healthcare information is a challenge. People with good literacy skills often find it challenging to understand medical vocabulary and the basic concepts of health and medicine, such as body works or how to navigate the healthcare system. Familiarize staff with health literacy. This could be done with the staff meeting on culturally appropriate materials using plain language, as well as utilizing materials that is at a 5th through 8th grade level, reading level. It is also important to assess staff on health literacy. This will give them an idea on how material can be projected in the general public and tribal communities. There are many types of tools and methods you can utilize to help make materials understandable. One of the ones that I have listed is photonovela. Photonovela is a way to make materials understandable to people with low literacy skills. It's almost similar to photo voice, which can also be utilized to reach an audience. And as mentioned before, utilizing assessments for health literacy. So one type of visual that is increasing in popularity for those with low literacy skills is photonovela. Photonovela is a health education item that is formatted like a comic book. It contains photographs instead of drawings. It includes easy to read text to tell a story and stimulate discussion with patients who struggle with low literacy levels. It is a popular form of entertainment literature in Central and South America. Often the learners themselves help write and design the photonovela. This creates an empowering experience resulting in a piece of educational material that reflects a particular group of people in the community. Those from the community who are not involved in the production of the photonovela will identify with the message because it closely reflects to their beliefs. From what I discovered about photonovela, it is a 4-step process. 1, acquiring resources. 2, developing the content by choosing the topic, listing points to be covered, and selecting appropriate visuals and text. Drawing on a large piece of paper a grid with a section for each point. Brainstorm ideas for the photos. Adding texts, ideas to each grid. Determining the final version of the photos in text. 3, produce the photonovela by selecting actors who match the ethnicity of the audience. Setting the scene for each photo shoot, considering characters for each shoot, their gestures, expressions, and various clothing items needed. Shooting the photos with a digital camera and downloading the photos. Inserting the text into bubbles for dialogue. Completing the final editing, translating the second language if necessary, using a native speaker for the translation. And 4, pilot tests. This can be done by assessing and evaluating and arranging focus group. During the process, it is important to assess whether the material attracts and holds attention and if it is accurately perceived. 13, cultural and linguistically appropriate services. So cultural competence recognizes the cultural beliefs, values, attitudes, traditions, languages, preferences, health practices, and diverse populations to apply the knowledge to produce a positive health outcome. Healthcare professionals have their own culture and language. So for an example, with healthcare professionals have their own culture and language, there could be a tribe that is the same tribe but have a different dialect. If you look on one of the top pictures for our promotional signage with smoke-free signage, it says Chunli Umpeshni, and that's with the Lakota dialect. I think the tobacco prevention is through Good Health and Wellness is working with the Dakota dialect. So with that, it'll probably read Chundi Umpeshni. And on the bottom left is the bottom right, is another cultural and linguistic healthy promotional signage. And we use the Lakota language for this one to relate to the audience, which is the top sign where it says Mini Wichoni. And this was also done during the Dakota Access Pipeline, so the audience was able to relate to it more in drinking more water. Many healthcare professionals adopt the culture of medicine and language of their specialty as a result of the training and work environment. So health literacy policies. Key principles for the policy, the right for information. Consumers have a right to information. It is the responsibility of healthcare providers to communicate effectively and check consumers' understanding of information communicated. 2, consumers have the right to be involved in decision-making about their health and well-being. 3, a services health literacy environment should support and empower consumers to make effective decisions and take appropriate actions for their health and healthcare. A health literacy policy should require consideration of health literacy and communication in service planning and environmental design of facilities. Involvement, consumers to be involved in service planning and environmental designs of the service, and the development of consumer information materials. So it should be easily understood. Staff to be offered opportunities to undertake professional development activities in health literacy and communication, and to develop skills to ensure consumers understand information being provided. All spoken written communication targeting consumers to be easily understood, tailored to the needs of the people from a diverse range of backgrounds. Regular assessments to all health literacy and communication aspects of the service and environment. And support and participation, organizational advocacy, support, and or participation in community activities that promote literacy and health literacy. You can further support communication and health literacy by incorporating its consideration into a broad range of policies, project goals, and evaluation criteria for programs and projects. For example, SMART, which is specific, measurable, achievable, relevant, and time-based. Goal for induction training could be provide new employees with training in health literacy and effective communication within 6 months of their employment. Your organization is likely to have many policies relevant to health literacy, including communication or plain language policy, an accessible information policy, a style guide, signage policy protocols, a quality and safety policy, customer service policy, consumer-centered care policy, consumer engagement policy, a policy about consumer rights and responsibilities, and policies about using and engaging language services, providing easy English version of documents and responding to other special communication needs. Advocating for health literacy in your organization. Make the case for health literacy. It is important that people that are making the case review the policies so that it's sustainable. Incorporating health literacy into mission and planning. Establish accountability for health literacy and activities. And here are some tools for health literacy. Some that I found: plain language. Remember that it's important that any promotional signage or anything that you relate to your patients or the community, tribal community, it's important to use 5th through 8th grade reading level. Plain language is a great source to utilize. The source has tips, tools, plain language training, training resources, examples, and much more for implementation. Ask Me 3 was designed by health literacy experts and is intended to help patients become more active members of their healthcare team and provide a critical platform to improve communication between patients, families, and healthcare professionals. Pfizer is another great source to utilize as it works with nationally recognized organizations, experts to develop tools and solutions to improve communication between patients and providers. And there's a lot of information, tools that you can utilize, and there's a lot of assessments that you can find all over the web. When finding health literacy, it's pretty broad and it's actually fairly easy. So, and there's a lot more health literacy tools that you can utilize. And is there any questions? Sorry, I'll leave that up to Deverell to ask.
Okay, thank you, Eugene, for sharing that information regarding health literacy. At this time, I'd like to open the floor for a question and answer section of the webinar. Please feel free to unmute your line if you have a question, or feel free to type in the chat box. if there are no questions about the presentation, we encourage you to fill out the evaluation feedback form. I just sent it out to everybody in the chat box. I believe I did. There you go. Well, once again, thank you for joining us for this month's Community Health webinar series about health literacy. Our next Community Health webinar series is scheduled for Wednesday, July 12th. And the topic for that webinar will be Better Choices, Better Health, a chronic disease self-management program. Thank you all, and we look forward to seeing you on our future webinars. Have a great day and enjoy the summer weather.